So, welcome to this webinar. It wasn't just my trauma, it was ours. Healing Together After Birth Trauma with Couples Therapy. I'm Dr. Irena, a psychologist, certified EFT therapist, and prospective EFT supervisor. And this will be one of many webinars that I am hoping to give on various reproductive topics. The next one will be on pregnancy loss and then, infertility. And my goal is to really start shedding light that we need to not only focus on the birthing parent, but actually on the non-birthing parent and see couples together. So the plan for today is that I'll talk what is birth trauma, the effects on both partners, and then the relationship. Can trauma be an attachment injury? And I'll define that. Why couples need to heal together, and why emotionally focused couples therapy as one of the probably best modalities for couples to be seen. What is birth trauma? Birth trauma is actually refers to any childbirth experience perceived as distressing or life-threatening by a person giving birth. And I think the key here is life-threatening. And it can include emergency C-section, unexpected complications, usually health complications, both for mom, any kind of medical complications, including also for the baby, some serious medical issues that can lead later on to developmental health issues, developmental delay, and unfortunately, I have to say also stillbirth. Lack of consent during procedures, feeling unheard, distressed, or powerless, and premature birth or other complications where the baby has to stay in the NICU, and of course mother-infant separation. And trauma is subjective. What does it mean? Trauma is always in the eye of the beholder. So moms can perceive a birth as being traumatic, while clinician like an OB can perceive the same event as being routine or actually very successful. And I do want to say that they're both true. The same event, the same birth can be for very successful clinically, because the OB was able to save mom or the baby, most often the baby. So from her perspective, the birth is actually turned out to be well. And at the same time, mom can perceive birth as being traumatic. So I do want to say that both perspectives can coexist and they're both valid, that it can be a traumatic experience for mom and at the same time routine or successful for the clinician. How common is birth trauma? And it's really surprising. I know that I was personally really surprised. It actually, 1 in 3 moms in the US perceives birth as being traumatic. That's really, really high. And, internationally, it's even higher. It's almost like 1 in 2, like 44% show that moms can perceive birth as being traumatic. And how does birth trauma affect each partner? Let's talk about the birthing partner. Most often, first thing that happens, it can either promote or impede breastfeeding. So moms that really feel like, I failed my baby at birth, I really wanted to be, do it like vaginally or natural birth, I ended up with a C-section. So she may really put a lot of pressure on herself to breastfeed, to kind of like compensate and provide something for her baby. On the other side, if she feels, that her body was invaded. If she feels uncomfortable with a touch, she may actually completely avoid, breastfeeding. It can affect mother-infant interaction. And what happens is that, we can most because, mom felt, this was, she can feel that she felt her baby. She actually wasn't able to protect her baby, especially if there's some, health issues, with the baby. She may be hyper alert, meaning that she can perceive now small, signals as being threatening, and she can be, overly protective of her baby. And I want to say a lot of women, especially if it's the first pregnancy, so they don't have the experience of, like, good, kind of like not traumatic birth, they would avoid, getting pregnant again and having a second child. Or, what can happen is that, when she is ready, or actually when the couple is ready to have a second child, that can be incredibly triggering. And I would say you can expect a lot of referrals will come at that time. And the new pregnancy will really trigger the experience of the first trauma, and will be, of course, the opportunity to relive and process. But the next pregnancy is going to be high anxiety, and that's expected and that's normal. What happens to a non-birthing partner? Um, uh, he or they, have can have secondary trauma, from witnessing a very scary event. Most often, what happens is that the partner, non-birthing partner, feels also traumatized, but he feels that, he had to be strong, to be strong for their partner. And also, what's important is that he feels that because he's not the one who gave birth, who, like, has physically kind of like experienced labor and whatever happened, trauma of labor, that he's not entitled to ask for help. So he's going to suffer silently. What happens with the relationship? How can in what way traumatic birth impacts the relationship? um, Very often communication can break down. So one partner can become withdrawn. I mean, it can be most often like a non-birthing partner, and the birthing partner can be angry, irritable, hypervigilant, and all of that, kind of like these behaviors can be misinterpreted. Um, and this behavior can be misinterpreted as, for example, disinterest, kind of like you didn't care about the baby, you didn't suffer, resentment. Um, and the non-birthing partner can, completely, be detached, because he doesn't know really what to do. And of course, women will avoid physical intimacy because it's too uncomfortable. Postpartum role disruption, the non-birthing partner often feels incredibly left out and out of place, like he doesn't know what to do. He wants to help, but doesn't know what to do. And he's also very often left out of the healing process. And what happens, actually, probably the biggest issue here is that different grieving styles. Most often, and I'm talking female partner, like birthing partner, may want to talk about, and often kind of like talk over and over repeatedly, to try to process what happened. And the non-birthing partner, again, most often male partner, don't want to talk about it, or he feels like, I've talked about this, we're done, how much longer do we need to talk about this? He may also not may not want to talk about this because he feels that, if I talk about, what happened, I'm going to make my partner upset. And these different grieving styles, they're not signs of incompatibility, they're really just sign of like different trauma processing. And if they're not addressed, I mean, it is in a way, this is normal, but it's expected. But if they're not addressed, these differences can lead to resentment and feeling abandoned, and really lead to, distancing between partners. Okay. So can birth trauma really be an attachment injury? So let me kind of like define what is attachment injury. It's Basically, emotional trauma, emotional abandonment in a very significant, tender moment. And coming from emotionally focused therapy, or basically, coming from attachment theory, attachment injury is a perceived abandonment during a moment of critical need by someone you relied on for safety. So the key here is the moment of critical need. So when you're feeling in pain, when you're scared, you need to have your someone that who's there to support you, to really be there for you in response. So um, can birth trauma really be an attachment injury? So I would say that, childbirth is the most vulnerable and emotionally charged event a person can experience. A woman can be in severe pain, if you're not taking medicine, and even if you're taking epidural, you're feeling disoriented, you're physically and emotionally exposed. And I would say moms are so focused on the baby and the health of the baby and delivering the healthy baby. So you kind of like you'll have to let go of your control and completely rely on the medical team for safety and care and support. So you have to have really very trusted team that you kind of like expect, and you can rely that they're going to take care of you. So when a trusted physician or a nurse fails to respond empathically and ignores pleas for help, or make decisions without consent, it can really feel like an abandonment, or a betrayal. And these small actions of dismissive tone or unnecessary comment, or procedures that are, done without informed consent, kind of like, split second, the physician make a decision, they can have really become searing emotional injuries. And I do want to emphasize these can be small actions with huge impact and huge emotional scars. So let me give you an example of kind of like small action, big injury. One of the women that I was working with, she was actually an ER, practitioner, medical practitioner. So she's really very comfortable with like blood and emergencies, but this was different because she was in labor, and she was in labor at 18 weeks, kind of like giving birth at 18 weeks, and, went to the bathroom and, ended up kind of like catching the baby in her hands. So she was scared, called the nurse. And the nurse was first rushed, didn't have time to come. So this like small delay of like, I don't have time for you, and I am, the woman was like in pain and in acute distress. And then when she came, she was like rushed, and sounded frustrated. So, you know, from nurse's perspective, she's probably running from one room, one labor LD labor and delivery room to the next. She's probably really rushed, but her tone of being frustrated, not having time, really told my patient, "You don't matter. I don't have time for you. Your pain, your fear doesn't matter." You know. Um, Another, kind of like following that, another situation that happened is that my patient ended up seeing another, I think it was a midwife. And while she was, in pain, scared, kind of like really distressed, talking about what happened, this, I think it was a midwife, her face seemed very flat. And it's interesting, the fact that her face was flat, non-responsive, probably she assumes it was, because of Botox, um, told her like she didn't have this empathic response. And again, these are very small incidences, but told my patient, I cannot rely on anyone. I am scared. I am in pain. I don't know what to do. Nobody sees me. Nobody can come here to help me. And of course, had a big, left a big emotional scar. So why does healing need to happen in a happen to why healing needs to happen as a couple. Postpartum care, always focuses only on the birthing parent, and the non-birthing parent is their experience is sidelined. But healing is the most powerful when it happens in the relationship, and here's why. Both parents, trauma is a shared experience. Both parents live through trauma, and have emotional scars from it. What's different is that the birthing parent may carry kind of like more visceral physical experience, of trauma of the birth. But non-birthing parent is also affected on, he witnessed, felt helpless. And what you'll often hear is that he didn't know what was going on. He feared about the life and safety for primarily his partner, and then partner and the baby. Trauma can undermine and disrupt the bond. It can lead to, of course, emotional distancing, relationship distress, and you know, um, those both parents, actually um, bring this traumatic experience and trauma in the relationship, and feeling of being abandoned, unsupported, and it can create additional attachment injury, the one that lingers, underneath the surface. And I do want to say, when we have this unspoken, unprocessed pain, sometimes parents, they don't even have the words, to describe and talk about this. It can lead to disconnection. Couples can grow further apart, and they can actually retreat into their own safe but unresolved experiences, where they're distant and they can't help each other process what happened. And I do want to say, both partners witnessed and experienced something really big, and you can heal in isolation. This is too big to heal alone. We need connection. Healing comes from being seen, held, and emotionally supported, especially by the person that matters the most. So even if there was traumatic birth, healing needs to happen between, the birthing partner and her non and her partner. And of course, studies show that emotionally secure relationship, like, can regulate stress, reduce trauma response at a very in a neurological level. So emotional closeness isn't just comforting, but it's also healing. Um, and why emotionally focused couples therapy? Because it's proven by research. It's supported by research that it's very effective for um, couples who have experienced trauma, any type of trauma. And we have studies show that, EFT can reduce threat response in the brain and increase feelings of safety when partner who's, in distress holds her partner's hand. Um, and there's additional research that shows that EFT significantly reduces PTSD symptoms and improves marital satisfaction in a couple facing infertility related trauma. And I would say that this is grief, that's very similar to traumatic birth. It's actually has to deal with pregnancy. Yeah. Has to deal with uh, reproductive issues. So how can, emotionally focused therapy help couples, heal after traumatic birth? They can make sense of trauma together. Most often, couples carry different narratives about what happened during the birth. They facilitate, so each partner has their own experience, but they really don't know how to talk. And they can actually, in therapy, they can facilitate, they can create shared meaning making of the traumatic experience. It can rebuild emotional safety. Trauma disrupts sense of safety, meaning the world is not safe. Um, but partners can learn to be sensitive and aware of each other's pain and fear, and be present, be emotionally responsive, to partner's pain. So let's say when one partner is maybe re-experiencing or dealing with, memories, of traumatic birth, or, she's scared about baby safety, her partner can say, I see you're hurting. I see you're scared. I'm here for you. You're not alone. We can't change the past, but I can be here for you when you're afraid. And uh, 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 and touch it can also create more space for intimacy and physical connection, because touch can be incredibly overwhelming and triggering for the partner who's experienced trauma. um, so when is a good time to seek therapy? Anytime. Well, it's always a good time. But let's say kind of like particular situations. For example, when couples talk about increased emotional distance, recurring arguments about birth, like what happened, why didn't you do something, lack of intimacy, both physical and emotional, difficulty co-parenting. And I have to say, like you can some probably see often situation where parents can, even kind of like years later, this can be kind of like a lingering resentment and conflict that can, show up years later. um, Again, lingering resentment. And I would say a really big trigger is getting ready for another pregnancy. For example, couples can be fine. They really can be fine for a couple of years until they're ready to start thinking for another pregnancy. And I've also seen it that they can be very triggered, even if the mom is not going to carry the pregnancy, even if it's a surrogate pregnancy, she can still be, triggered. So let me kind of like give you a vignette of not the whole case, but a vignette of hypothetical couple, kind of like what can happen in therapy. Sarah really wanted to have, natural birth. She prepared herself when, physically was, all fit. They went to childbirth classes. She felt really determined to deliver the baby naturally. Miguel was fully supportive, but, birth didn't progress the way she wanted. So they ended up with emergency C-section. So this is one of those situations, after hours of laboring, the physician comes in, sees the baby's in distress, and 6 minutes later, the baby's delivered, via C-section. And Sarah felt, of course, scared, but very scared, and she ended up, after the birth, really very angry at Miguel. For not stepping in, for not speaking up, for not advocating for her in her birthing plan, and and he didn't know how to respond. So in therapy, this is kind of like a moment in therapy when, and this happened kind of like very early on, when he was given an opportunity to talk about his experience. And again, very often, non-birthing partner, he doesn't even, nobody asks them, how what they've seen, what they've witnessed. And when he had a chance to actually talk about his experience, in labor, he looked down, he was kind of like visibly distressed, and he started talking about how he froze. He got really scared of losing Sarah and the baby, and he didn't know what to do, and at the same time he thought like, I know this is critical, but I'm going to be strong. I'm going to be strong. I'm going to be strong for me and for Sarah. And he didn't know what to do. But later on, he could, in therapy, he could really see Sarah's perspective. And this moment of hearing Miguel's perspective, the fact that he saw her, the trauma, he saw the trauma, he saw what was happening with Sarah. He was scared too, was meaningful. And her response was like, she was all teary. She said, that's all I needed. I needed to know you were scared too, and I needed to know that you were there. You were there. You were affected too by this experience. So, what are the key takeaways? Birth trauma can deeply impact both partners and the couple. I would argue that couples therapy, that women should not be, or the birthing partner should not be seeing alone, but it should be seen with their partners. And couples therapy really offers opportunity for shared healing. And we borrow on the other partner as a resource at times of pain and stress. And emotionally focused therapy is a powerful evidence-based, framework for treatment. Okay, so we are now ready for, if you guys have any questions, you are um, feel free to put them in the chat. I do have to say, while we're waiting for questions, I do have the next slide is uh, the next slide is actual bibliography. You're all going to receive a recording in the next couple of weeks. But if you want a separate slide, just the bibliography, I'll be happy to share this with you. So let's see. Um, uh, yeah. Okay, I'll wait for a few more minutes to see if there are questions. But, basically, if you this is my contact information. Feel free to stay in touch because, again, this is just one of the series of webinars. In the next couple of months, I'm planning to do pregnancy loss, um, and then I will be doing infertility, so various reproductive topics. Okay, let me see. Uh, okay. Oh, okay. So here's a question from Diane. Diane says that she's developed OCD and anxiety after it's been overwhelming, and I'm getting help for it. But the question that keeps popping in my mind is why. Um, I do have to say it's common, kind of like understanding, like trying to make sense. And Diane, I'm first thing, I'm really sorry you had to go through this, and it's very common that you kind of like just wonder why did it have to happen, or what did my didn't my physician or OB step in, so this is all, it completely makes sense. I would say, have you had a chance to maybe have a conversation with your OB and kind of like review, kind of like recap, and see uh, what happened and why it happened. And here's another question: how do you prevent birthing trauma? I would say, for maybe this is very applicable for couples who have already gone through birth trauma. I would say definitely get additional help like doula. And I would also say, talk to your physician, spend a lot of time educating your physician and telling them. I mean, of course, you need to not find a physician who is sensitive, responsive, who wants to hear you. Um, and, talk to them about what was difficult for you with the experience that you've gone through and what you need to feel safe. And not that they can I mean, the bottom line is you never know how the birth is going to go, but you need to have a physician who can hear your fear, and not undermine it, but really take it very seriously, and at least try to respond, as best as they can. um okay, so let me see, Mel Johnson. Okay. How can prepare couples for the possibility of unexpected or traumatic birth experience without creating fear? This is that's interesting. I To be honest, I don't know. I would more talk to them about, I do appreciate this that, talking about possible trauma, can scare them. I would say talk to them about, things that can go things are unpredictable during labor. You don't know, what can happen, and that they need to kind of like be able to communicate, kind of like what is kind of like, talk to couples, like what happens if if you're birthing and you're in pain. What do you want your partner to do? What can he do to kind of like stay, be on your side and protect you, and be supportive of you. um Okay. So I think that this would be all. Thank you all for coming. This was really a pleasure to see all of you. I really appreciate you all coming. And again, stay tuned because this is one of, um, many other webinars on various reproductive topics and couples. And yeah, so stay in touch, and I'll see you again hopefully in a couple of months. Bye now.